Now, the news that dentists could reopen last week came as a relief, literally, to anyone who'd been putting off treatment during lockdown or who hadn't qualified for emergency work. Around 60% of dental practices in the southeast are thought now to have reopened, but some are running at about a fifth of their usual capacity. And the extra guidelines now mean the cost of PPE can increase by around 6,000% since before the pandemic. For tonight's special report, Peter Whittlesey has been to one surgery in Eastbourne.
This is the new greeting for patients attending dental appointments.
I've just got to take your temperature, so do you mind just taking your hat off for a moment?
Since the 8th of June, all surgeries can open as long as they're COVID secure. That means full personal protective equipment for staff as they grapple with a 3-month backlog of patients needing urgent and often emergency treatment.
Well, one cap has fallen off.
Yep.
I've lost a filling from behind that front tooth there.
For patient Richard Kirk, the obvious infection control measures are reassuring.
No, I'm not surprised because I expected it and I was hoping it was going to be this way because my wife is shielding, so I don't want to take anything back to her.
The new normal means staff have to change their PPE after every appointment at the cost of £50 per patient, as well as rotating and deep cleaning surgeries.
We have to swap surgeries between patients, we have to let the surgery air settle down, we have got a cleaning time which is much increased, we have to socially distance, we have to make sure that the team is safe and our patients are safe, and so we can only book one patient per hour.
The British Dental Association has said these new measures have dramatically increased costs, and unless the government steps in, dental treatment could become unaffordable. This Eastbourne practice has introduced many new ways of working, including using tablets as flashcards, as not all patients can hear their dentists through their masks. But increasing capacity to meet demand is one problem they can't solve.
There is a crisis in dentistry. There is definitely a crisis in dentistry. I think that the number of urgent cases that have happened during lockdown, every practice must have their list of them, and every practice is probably keen to get back and get working on those patients so we can get those people out of pain.
This practice can now only schedule 8 appointments a day, meaning it'll be another week before all patients requiring emergency treatment can be seen. Peter Whittlesey, BBC South East Today, Eastbourne.
They've been shut for 3